In this module, we will look at the female sexual anatomy and physiology, but we will focus on the internal genitalia and the breasts. As we stated in the previous module, the vulva, which is often referred to incorrectly as the vagina, is the external part, that which we could see visibly without being invasive at all. But when we start going inside the reproductive system of the female, we go through the vaginal cavity. The vagina is a thin-walled accordion-like tube that expands, and it basically goes from the introitus to the cervix. The introitus is basically the outermost part in the vulva, and that enters into the cervix in here. This is the organ for intercourse, for delivering a child, and also for the menses. There is a lubrication that basically occurs, and this is what we call transudation process. Transudation is basically the term that's used to describe the lubrication that occurs naturally in women. When we look at lubrication in women, we're talking about an amazing capacity for the vagina to clean itself. There are a lot of products out there that are sold with the purpose of as they claim, enhancing hygiene, but the vagina has an amazing capacity to just keep itself clean. In fact, with water, it would be enough. Adding some of these products that are sold on the market sometimes could kill the healthy bacteria, which could mess with the pH balance and bring about more susceptibility for infections, and also the need to use more. Think of transudation as the sweating component. In fact, if you speak Spanish, you know that sweating is sudar, which would be like the center part of the word in here. And there are these pore-like openings in the vaginal walls that whenever it's engorged with blood, it basically brings about a transudation. And that is where a significant portion of the lubricant that's present during intercourse comes from. We also find that the mucus from the cervix is also involved in there. In fact, it's often used by people to determine whether someone is fertile or not. If it is a thick mucus that is thick as in white and then you could see it, then there's a less likelihood that the woman would be fertile at that time, as the mucus there serves a purpose to trap the sperm and not allow it to get to the ovum. But if the mucus is rather clear and very liquidy, kind of transparent, then there is a higher probability that the woman would be fertile, as it would facilitate the process of the sperm to reach the egg that's ready to be fertilized. We also find that when it comes down to the vagina, the first 1/3 of it contains many nerve endings. However, the inner part of the vagina has little nerves. In fact, there are procedures that are done on women, sometimes with little to no anesthesia, because of this specific reason. This has been often brought up as a point to describe perhaps the need or lack thereof for a longer penis and to stimulate pleasure. And we find that the majority of women actually report more pleasure when there is stimulation in the outer part of the vagina, rather than the inner part. Going in deeper may actually bring about discomfort, as that there is a greater likelihood that they would tap into the cervix and other parts that would not be so pleasant. The famous or infamous Gspot, Grafenberg spot, is one that continues to be controversial because there isn't scientific proof that it exists. However, there are some women that have lend themselves and participated in studies where they are searching for this particular spot because of its known sensitivity to bring about pleasure. Now, if it does exist, it is believed to be about a dime to a quarter size spot in the lower third of the anterior vaginal wall. Anterior, we're actually talking about to the front. If you're facing the front part of the body, that's where we would say it is, and it's about 2 to 3 inches up. Now, this would be most stimulated or easily stimulated by fingers rather than a penis. The reason why is because there would be a need to kind of bend it toward the front of it, and doing so with the fingers is a lot easier because of the joints of the fingers. The penis may be able to stimulate it depending on the penetration or the angle, but it would not necessarily bend to rub that specific part. If it does exist, we would actually find it to be. Here we see an interview of the clitoris and the internal reproductive system. When we look at the G-spot in here, if it in fact does exist, which again we have no scientific evidence that it does, it would be in the anterior part of the vaginal wall, toward this area here. The clitoris here, as stated earlier, is made up not only of the bulb that we see here, but it's made up of legs, and they wrap around the vagina here. Inside the dotted line that you see here would be the clitoris that would not be engorged with blood, or it would actually be in detumescence, meaning not erect at all. But whenever there is arousal, you would see that there would be an enlargement of this in here, and it would come around and cover more ground. This is why when asking individuals about whether the size of a penis matters to stimulate the female, the inside would not so much, because again there's no nerve endings in there. But if there is a girth, then there is a greater likelihood that you would stimulate the clitoris through the outer part. This, as I hope, gives you a better idea of what the inner part of the sexual reproductive system in a female looks like. We'll be talking and showing more pictures later. The uterus is, the uterine wall is about 1 inch thick, and it is made up of 3 different layers. When we talk, this is the part that is between the bladder and the rectum, and this is where the monthly cycle of change occurs, the menstruation. Basically provides a path for the sperm to reach any fertilized egg, and it is also responsible for protecting a fetus when pregnancy occurs. The various powerful contractions that are often known as cramps would basically allow for the menses to be expelled and also for the fetus to be pushed out. The outer layer is called the perimetrium, and that's the part of the tissue that covers most abdominal organs. The muscular layer of the uterus is called the myometrium, and this contracts to expel the menstrual fluid and to push the fetus out of the womb during childbirth. And then the inner layer of the uterus is what we call the endometrium, and this responds to fluctuating hormone levels, and its outer portion is shed with each menstrual cycle. So during 23 days, the endometrial layer would be filled with a thicker layer, and then if there's no pregnancy, then it would be shed with these powerful contractions in there that are brought forth again facilitated by the myometrium layer, the second layer that we have there. At the bottom of the uterus, we can see the cervix, and in fact, it is something that would be visible with a mirror during pelvic examination. When a gynecologist or medical professional does a genital or cervical examination, they're able to see it directly in there. And some women are interested in seeing that, and with a mirror they'd be able to also see what the gynecologist is seeing. This is at the bottom of the uterus, as stated earlier, and it secretes mucus to help or impede the sperm. Depending on whether the woman is fertile at the time or not, you would see a secretion of mucus that would either trap the sperm so that it would not enter in deeper, or it would allow for the sperm to swim and navigate in there easily. The os is the opening of the cervix to the uterus that allows passage between the vagina and the uterus. So the menses and sperm will flow through here, and this is what's of interest for the IUDs. You may have heard of that, intrauterine device. It's a little T-shaped piece of plastic inserted into the uterus via the os to provide birth control. We'll be talking about this a little bit more in detail in future chapters. Here you can appreciate a side view of the internal reproductive system of a female. Here at the very top you have the fallopian tube, you have the ovary here in blue, There you would see the follicles ripen that eventually give way to ova. Ova is plural, ovum is singular for the eggs, and then they would actually make their way over. The uterus here, again, you already know that about the uterus being made up of 3 different layers. Please review those: the perimetrium, the myometrium, and the endometrium. And here we would have the bladder here, and then you'd have the vaginal cavity here. Here is the cervix that we have, and then this would be the os, the opening that was mentioned just in the previous slide. The Bartholin's glands, which is right here, was originally believed to be the creation, where the lubrication that women secreted came from. We now know that that is not correct. And then you'd again have the clitoris. Basically, this is the bulb, but then you'd see that around through here. Here we have a front view of the internal reproductive system. It's just what we described in here. And you can appreciate everything that is here. You could see the os a little bit more clearly here. You'd have the endometrium, you have the myometrium, and then the perimetrium, which is this is the entire uterus here. The cervix, you'd have the Gspot that you'd have in there. Veins over here, the ovaries, and then you'd have the fallopian tubes here. As stated earlier, there is a lot more funding and greater interest, sadly, in learning about erectile dysfunction than about the breasts. The breasts are amazing, but we do live in a society where we've sexualized them so much and we've forgotten about some of the most essential aspect of it. Now, they are erogenous zones, areas of the body, that is to say that they have nerve endings that when stimulated would bring about sexual arousal, but that's not the only thing they do. The breast, mammary glands are modified sweat glands that produce milk. There's lactiferous sinuses, which is where the milk is stored, and we find that in there these glands would allow a woman to produce milk. This is a byproduct of several hormones working in tandem and various ducts in the breast that would allow for the milk to travel through and be produced. Now, each breast contains about 15 to 20 lobes and milk-producing glands that are called alveoli. And these alveoli basically are connected to secondary tubules. I'll show you a picture in a few. These would then go on to the mammary ducts. Those will then go on to the lactiferous sinus, and then that would come out through the nipple. The sucking would be would stimulate the pituitary gland to release a hormone that we call prolactin, and that would begin the milk synthesis. This is based on existing protein in the body of women, and then oxytocin also would come into play to help release the milk. Despite this amazing capacity, we find that breast augmentation more than tripled from 1997 to 2008, according to the American Society for Aesthetic Plastic Surgery. And this is the most common cosmetic procedure for American women. Interestingly, in various parts of the world still, women are walking around topless. And when they're exposed even to men, men do not view them as this sexualized part. I remember this particular documentary that was fascinating of women that perceived beauty to be in the teeth. And in fact, it wasn't just healthy teeth, it was in the shape of the teeth. And so women would go through in this, it was I believe in the Amazon, they would go through the witch doctor, the main guru of the village, and he would, through a ceremony, file their teeth so they could look really, really pointy. When they were done, women basically had their front teeth look kind of like a W. They had been filed and shaped differently. These women, it was very uncomfortable. There was no anesthesia, and when they were done with this procedure, by the way, they were topless and exposed throughout the entire time. When one was done, in her dialect was asked, "What do you think? How do you feel?" She said, "I feel very pretty, and I don't think my husband will ever leave me now." When I describe this story and I share it with people, oftentimes I see their facial expressions, which are a sign of discomfort and confusion as to why women would put themselves through such trouble. Well, this same woman was asked a question. Hey, what would you think about cutting your breast open to put something in there or modify it? And the woman's expression was very similar to that of American women when I described the same procedure of the tooth filing. She said, why would women want to do that? They're just breast. But we go back to the power and the theory, which would be the cognitive theory that would say that the perception of body parts is based on our experience and what we've been taught. Here you see a side view and a front view of the amazing breast. And again, keep in mind that the alveoli basically are connected over to the different secondary tubules that then give way to the mammary ducts and then the lactiferous sinuses that would eventually give way to the releasing of the milk here. Please keep in mind that a lot of this right here is also just fat, which is what we have, but these lobes right here is what give way to a lot of the milk that's there. By the way, when it comes down to recreating something as good and nutritious for babies, we have yet to find a formula that does that. Breast milk is considered to be very sweet, and it's often used also to reduce pain in babies. We understand the discomfort that may be generated with women with continuous sucking and the soreness, but to this day there isn't anything that compares to this. In fact, when it comes down to the breast milk, it is metabolized by babies a lot faster than they metabolize formula, which again is a discomfort for the woman. Whereas a child may want to be breastfed every 3 to 4 hours when they consume breast milk, whereas if they consume formula, they may want to eat every 4 to 6 hours. Now, eating 4 to 6 hours is more convenient for the parent, as there is less care, less concern. But as you may know about dieting, eating more frequently is better for us in terms of weight gain. So a lot of different things in here that have even been tied to overweight and obesity later in life. Interestingly, again, please keep in mind that this is the synthesis of milk is a very elegant work that occurs between the pituitary gland, the hypothalamus, and a lot of peptides, a lot of hormones, prolactin and oxytocin. And interestingly, what we find is that there are women that are sometimes with the sound of their baby crying alone will start secreting and synthesizing milk. This has also been tested with other babies crying, and when women are nursing, when they're breastfeeding, just the sound alone of that would produce milk. It's not just sucking as we thought. So think of the amazing interactions that exist between the brain and our physiological response for women to then start synthesizing milk.